Let me talk for a moment about something that's I've heard from a number of superintendents and health directors, and very, very concerned. And let me just say again, very impressed with what our teachers are doing, what our principals are doing, what our superintendents are doing. They're doing an absolutely phenomenal job trying to get as many of the kids back in school as they can. We've heard from many superintendents, though, about the number of students who are meeting the Centers for Disease Control and Prevention's definition of close contact and are being put into quarantine. In most cases, this is guidance from the CDC. So you might have a young person who is in class, let's say a high school student. It's determined that they have COVID. Then they go back and determine who they were seated within, a close distance, within 6 feet. And then the CDC guidelines talks about those individuals being quarantined. The CDC, and I'll just quote part of it, in the context of COVID-19, the definition of a close contact is someone who is within 6 feet of a person diagnosed with COVID-19 for a total of 15 minutes or more. I'll just go down a little bit. The determination of close contact should be made, this is what the CDC says, irrespective of whether the person with COVID-19 or the contact was wearing a mask. And so what people have said to us is, look, both people were wearing masks. Both students were wearing masks. They were within 6 feet, but they were both wearing masks. They were above 15 minutes, but they were both wearing masks. And shouldn't that count for something? So we're looking at this. Frankly, our health department and our health experts and others who we consult outside the health department are very reluctant to change this without data. So we're going to go out and try to get some data. And what we're going to do is to take the new tests, some of the new tests that are coming in from the White House that we expect to be here any day. We've asked Ohio State researchers to come up with a protocol. We're going to take 10 school districts or school buildings in the state. And what we're going to do is run a test, frankly, of those individuals who meet that criteria, who would normally have been quarantined, and we're going to follow them with very frequent strip tests, these new strip tests. So again, we'll have more details in the future. This is not the announcement of when we're going to start it, but I wanted to let everyone know that we are working on this. Frankly, we've seen a lot of gut-wrenching things and things that just, as a parent, bother me. Kids missing out on school, kids missing out on activities that they want to be involved in. But frankly, our medical experts do not feel that we can move off this without data. So what we're going to look at to see is, okay, let's follow these kids who had this exposure where both people had masks, they were within 6 feet of each other, and they were together for more than 15 minutes. And we're going to take some of those and follow them and just see what they do in fact develop. Do they in fact come down with a COVID or not, and what the percentages are, and see if the data can help inform us as how we move forward.